burden. So the challenges of where we're coming from, it's also challenged because it's increasingly complicated, and as you have providers getting more and more specialized and new medications, new devices, everything, it makes it hard to stay on top of everything.
So I think this area in particular is ripe for a team-based approach because this is it's a new area for cardiologists, right? And for some people who are going to require more complicated therapies, injectables, maybe they're on insulin, there has to be involvement with other specialists who might be more familiar than cardiologists, the endocrinologists.
Where we actually want to administer tests and adjudicate competency in all team members, not just a physician. Because traditionally the American Board of Internal Medicine only certifies physicians. But what about clinical pharmacists who have an equal stake in the care of these patients? What about nurse practitioners who have more than an equal stake in these patients?
We have a long way to go in how we collaborate and who needs the highest level of care, whereas who can be transitioned back to primary care to follow, and make sure that the patient stays on their meds and continues to follow that patient. So I think team-based care is really very, very important for heart failure because these patients have multiple comorbidities. They tend to have multiple social issues, and so I think having the entire team of primary care, specialty care, social work, heart failure clinics, disease management programs, I think you need all of those services and figure out what your individual patient needs.
The challenge is that historically I think things have been fairly siloed. So as the cardiologist, they're going to take care of the lipid management, the blood pressure, and heart failure or other kind of cardiac diseases. And then, in your note and in your conversation with the patient, you're going to say, all right, talk to your endocrinologist about your diabetes. So this idea of each of the different providers is really looking at just one piece of the puzzle. I think what we're finding is that increasingly all of these puzzle pieces are so intimately related that to really optimize care, it has to be across really their whole comorbidity burden.
And then there definitely has to be educational resources that are provided to the patient. So I think that when we talk about team care approach, that diabetes and heart disease is one of the perfect examples where we'll have to align resources and strategies to provide the best care. So yes, I think it is important.
We complain a lot about EMRs, and they're sometimes challenging to use, but the nice thing about it is you now have the ability to see what primary care says, you can see what the specialist says, you can see what the clinic visits look like, you can see what the hospitalization looks like, you can see what the labs are, and so we're all on one platform. So I think that has helped tremendously team-based care.
So, as we think about the right approach to team-based care, I think there are certain things, whether it's shared EHR, making sure you're having an actual conversation with the different providers and patients and giving them the information they need, but also at the very least making sure you're sharing all of the electronic health record data to really try to get over the challenges of medication mismanagement or polypharmacy that really can complicate the course for patients and their families.
We believe very strongly that for a chronic disease like heart failure, one has to, in fact, take a team approach. And that's partly why the HFSA is creating its own competency certification initiative.